Good day and welcome to today's webinar. We will get started in a few moments. Welcome everyone. This webinar is being hosted by SAMHSA's Gaines Center. Today, as part of a virtual learning community, this being the third session, a panel of experts will be sharing information about and experiences regarding mechanisms and platforms for efficient data and information sharing across criminal justice and behavioral health partners. I'm Richard Van Dorn, a Senior Research Associate in the Gaines Center, and I will be serving as the moderator for this event. Before we get started, I will share the following disclaimer. The views, opinions, and content expressed in this presentation and discussion do not necessarily reflect the views, opinions, or policies of the Center for Mental Health Services, the Center for Substance Abuse Treatment, the Substance Abuse and Mental Health Services Administration, or the U.S. Department of Health and Human Services. The virtual learning community on information and data sharing has been structured as a 1-hour presentation webinar with a 1-hour open discussion group, which follows immediately. A number of you submitted questions for discussion when you registered, and we will address those during the discussion group portion of this event. Additional questions can be posed by typing your questions into the Q&A pod on the right side of your screen. This webinar is being recorded. Slides will be available in a few days. A downloadable certificate of attendance will be available at the end of the webinar. Also, the Gaines TA Center has arranged for live captioning of today's webinar to enhance accessibility. To view live captioning, select the Accept button in the Multimedia pod located in the right-hand corner of your WebEx screen. You can change the color contrast of the live caption pod to suit your needs. We recommend selecting the high contrast style for best visibility. This slide provides the agenda for today's event. Dr. Victoria Chow from SAMHSA's Office of Behavioral Health Equity and Justice Involved is with us today to welcome registrants and to provide additional information about this information and data sharing virtual learning community series. After I welcome her, I will introduce our webinar presenters and discussion group expert participants. Dr. Chow, I'll now hand the microphone over to you.
Thank you, Richard. On behalf of the Substance Abuse and Mental Health Services Administration, also known as SAMHSA, welcome to the Data and Information Sharing Virtual Learning Community, hosted by SAMHSA's Gaines Center. The Gaines Center is SAMHSA's National Technical Assistance Center focused on expanding access to services for people with mental and/or substance use disorders who come into contact with the justice system. Today, people living with mental and substance use disorders are at their most vulnerable state. This includes people who are involved in the criminal and juvenile justice system. Behavioral health crises and concerns are mounting in today's current environment, where COVID-19, unemployment, and closing of businesses and behavioral health services, racism and excessive force against communities of color, and subsequent civil unrest are converging into a confluence of stress. In the U.S., prisons and jails are overrepresented with individuals who have mental and substance use disorders. In alignment with SAMHSA's mission to reduce the impact of substance abuse and mental illness on America's communities, SAMHSA recognizes the need for mental and substance use disorder treatment for individuals in contact with the justice system. SAMHSA continues to promote collaboration and partnerships across disciplines and sectors to better serve individuals with mental and/or substance use disorders and who are at risk for or who are already incarcerated. In this intersection of criminal justice and behavioral health, SAMHSA continues to promote the identification of individuals with mental and/or substance use disorders, use of evidence-based screening and assessment during pre- and post-adjudication, diversion of individuals from the justice system into home and community-based treatment, provision of training and technical assistance for law enforcement officers, juvenile and family court judges, probation officers, and other judicial decision makers, and the assurance of equitable opportunities for diversion and linkage to community services and supports for all populations in order to decrease disproportionate minority contact with the justice system. Today's webinar, titled Data Sharing Among Criminal Justice and Behavioral Health Partners, Mechanisms and Platforms for Efficient Data Information Sharing, is the third and final webinar for this virtual learning community. During these challenging times in this current environment, SAMHSA would like to thank the Gaines Center, the speakers, and the participants on this webinar for your participation in this virtual learning community and your continued dedication to improving the behavioral health of individuals incarcerated in the criminal justice system. Thank you. Richard, back to you.
Thank you, Victoria. Following up on Dr. Chow's remarks, the virtual learning community and its May, June, and July topics were born out of the recognition that many jurisdictions are seeking assistance in their efforts to use data to improve outcomes for people with mental health and substance use concerns. And with good reason, as cross-system information and data sharing allow for individual-level information to inform immediate and long-term community needs and to improve services, interventions, systems, and policies. However, there are challenges, including selecting from different mechanisms and platforms to host cross-system data integration efforts that also address both federal and state privacy and data security issues. To discuss these and other relevant issues, we are fortunate to have three speakers with us today. First, Chris Schneeweiss is Senior Management Analyst for Johnson County, Kansas, and has held the appointment of County HIPAA Healthcare Privacy Officer since 2013. Chris has 23 years of public service between Douglas County, Kansas, and Johnson County, Kansas, and he is a graduate of the University of Kansas. Next, Steve Hollis will be speaking. Steve began his career with the Columbia Boone County Health Department of Public Health and Human Services in 1996 and was promoted to Social Services Supervisor in 1999. In 2006, with the expansion of the department to include the newly formed Division of Human Services, Steve was named the Human Services Manager. The Division of Human Services works to address the causes and conditions of poverty by purchasing, coordinating, and providing social services in the local community. Steve is a graduate of the University of Missouri. Finally, Kim Keaton, who has nearly 15 years experience in policy and analysis in the homeless and housing sector. As Director for Data and Analytics at CSH, Ms. Keaton focuses on using data to drive efficiency, efficacy, and impact. She also leads CSH's Signature Fuse initiative, which has been implemented in nearly 30 communities across the country. Her expertise in data analysis and integration and program implementation serves to guide communities in efforts to cross-match data systems for effective targeting of frequent users of multiple public systems, such as corrections, homeless services, and hospitals and health systems. Prior to joining CSH, Ms. Keaton spent 6 years at the New York City Department of Homeless Services as Director of Project Management. Kim is a graduate of New York University's Wagner School, where she earned a Master of Public Administration degree, and she also holds an undergraduate degree from the University of California. Chris, you're up.
Thank you, everybody. This is, as he said, this is Chris Schneeweiss. I am with Johnson County Government. So to start us off today, I'm going to kind of give everybody a little bit of background of where Johnson County, Kansas exactly is, because I'm sure most people are not very familiar. We are part of the Kansas City metro area, which is approximately 2.3 million people. Johnson County makes up a little over 604,000 people. And from a geographical standpoint, if you look at this here, this is the Kansas City metro. We make up the southern west portion of the Kansas City metro area. So what I hope to go through today is kind of explain to you a little bit about who we are as Johnson County and what the objectives are in regards to what we have undertaken when it comes to data sharing, specifically between our criminal justice partners as well as our behavioral health partners. So in Johnson County, you have 20 different cities that make up Johnson County, and that is 17 different municipal and county law enforcement agencies. We have 2 separate jails in Johnson County that account for about 1,100 jail beds. And prior to COVID-19, we were averaging about 890 inmates a day. We're down a little bit because of COVID and some initiatives that have been put in place to keep people out of the jail so that we wouldn't have the spread of COVID-19. So again, the objectives today is to kind of give you guys an overview of how we got started as Johnson County and what are the platforms that we have developed to share data more efficiently and effectively. And those platforms that I'm going to touch on is our Justice Information Management System, or what we like to call JIMS, as well as our MyResource Connection application, or you'll hear me refer to it as MyRC. And then last but not least, we have used data and shared data in a way to help develop a predictive analytics model that I hope to go over with everybody today and give you a little bit of background of what that is. So to get started, how did Johnson County get started on this whole plan of sharing data? And what are ideas that we may be able to share with anybody out there who's either at the very early stages of wanting to share data, or if you're a little bit farther down the road, hopefully be able to share with you some other ideas and suggestions of things where you can hopefully overcome some of the barriers and obstacles that unfortunately we've had to go through over the last 10 to 20 years. So first and foremost, the one thing I always tell everybody is it's a great idea to share data, but you've got to be able to demonstrate the need to share data. It's not good enough simply to say, hey, we heard about this, I watched a webinar, I've read something, hey, everybody else around the country is doing it, why aren't we? All of that is great, but if you cannot demonstrate why you have a need to share that data, it's going to be a very hard sell, and you're going to have a hard time finding partners that are going to want to share data. The other thing I would strongly recommend is find a champion. For us, when we started down this road, we had one of our county commissioners and our current county manager at the time who were very big advocates, and they were the ones that championed the cause. They were the cheerleaders. They were the ones that provided the support every time people started to question what we were doing. Identify willing partners. I have worked with jurisdictions around the country, and I'm going to tell you right now, everybody has in mind who they think needs to be at the table and who would be a good partner. But the problem is, if you haven't spoken to those partners and they're not willing to share data, that's not even something they want to entertain, you're going to be dead in the water from the word go. Identify who can and cannot already share data. Because this is one of the biggest obstacles I can tell you as a healthcare and HIPAA compliance officer, is you have people out there who love to throw out HIPAA, 42 CFR Part 2, FERPA, every other acronym they can think of as reasons why they cannot share data. What you need to do is be able to identify who can under current statute, and that's not just HIPAA and federal statutes, that's also your state statutes, who is currently allowed to share data freely, because that's where you're going to want to start. That's the low-hanging fruit. One thing we have done in Johnson County, and I strongly recommend this to any time I do a presentation or talk with an outside organization, is secure outside counsel. If you rely, and we have our own legal department here in Johnson County, and I love them to death, and they're great people, and they do a really good job, but you know what? Most of them do not have the expertise in HIPAA and healthcare compliance, and because they are the legal department for Johnson County, their responsibility is to make sure we don't get in trouble. And the easiest way to do that is by shooting down every idea that comes along and just say no. So what we do is we secured outside third-party counsel that specializes in HIPAA and healthcare compliance, and they have been an asset when it's come to brokering deals, developing data sharing agreements, developing business associate agreements, and so on and so forth. And then last but not least, and this ties to finding a champion. Once you have you've started to make the progress of actually developing a data sharing initiative and a data sharing platform, and you have it up off the ground and it has legs, develop a governing board or an executive board, because whoever that champion is, so our county manager at the time, he's no longer the county manager for Johnson County. So if this was solely his idea, when he retired or when he moved on, it very well could have died on the vine because he now no longer was there to be the champion. So for us, we actually developed a governing board that oversees our platforms, and that provides the sustainability that you need to keep it going. So to get started, let's talk about Justice Information Management System. This is our criminal justice management or electronic management system that we developed in-house back in the 1990s. We took a vendor purchased product, bought the back-end platform from them, bought the proprietary rights, and then built upon it so that we could take somebody, a single database, from the minute you're booked into our jail all the way through the criminal justice system to where everybody uses the same platform. The district attorney's office, our public defender, our judges, the probation staff, our sheriff's office, everybody's entering the information into the same system, okay? That way you're not having to use this system, but I also have to log into another system to track this person's probation record. Once you're entered your information into GIMS, it follows you all the way through. And it was built on the design initiative that we wanted a business process. We wanted to be able to house all of our data in one centralized repository to where, again, everyone would be able to use a paperless system. Everything gets scanned into GIMS. You could have a historic record of it, and you could follow it all the way through. Now, the key is administrative access. So not everybody who has access to GIMS has the same level of access, which is going to be one of the key factors when it comes to sharing data regardless of platform, is you can have one system that houses all the same data. What you do then is control who has what level of access each person has. So as you can see here, our sheriff's office is not going to have the same level of access as our judges. And our judges have full access to where our community corrections and our court services probation units don't have that same level of access. And if there is information being entered in there that is protected data, it can be locked down and controlled who can gain access to that information and who cannot. But the thing where the GIMS system became really advantageous, and this is what I'm going to go on and show you now, is the way we were able to use that system to better serve our behavioral health and justice involved inmates. One of the things we have done here in Johnson County, and we have received quite a few accolades for, is we embedded mental health clinicians within our local law enforcement agencies. So we actually have someone who is part of Johnson County Mental Health, and they are paid for by the police department, but they are still a behavioral health clinician as part of Johnson County Mental Health that go out on calls with local law enforcement anytime there's reason to believe that that could be somebody who's in crisis or suffering from a behavioral health issue. So when they go out, they enter their system, their information into this screen that you see here that is inside our GIMS system. So they can actually come in here and put what kind of a call was it, what kind of referral was made. If there was a referral, what agency did they get referred to? Like in here it says Marillac, which is a local PRTF, psychiatric unit here in Johnson County. The thing is, because they're entering this information into GIMS, the big question always becomes, well, I thought this was a criminal justice electronic management system. How can that information sit in there if it's protected health data from Johnson County Mental Health? Because it depends on who has access to see that data. So in this case, this information doesn't readily get accessible by the judges or the DAs until a release gets signed, and then that whoever is authorized through that release to have that access then gets the access to be able to obtain that information. But by being able to house it all in one centralized repository, it allows our behavioral health providers in Johnson County to readily see and follow this person through the court system. Know when they get booked into the jail again. Know when they get released. Because if you're booked into the jail and you're not on your meds, that's something that we need to get down to the jail and get addressed now so that you don't get off your meds for 3, 4, 5 days and now you're back in crisis while you're in custody. So this is one example of how we've been able to do that. This is what I would arguably say is the best example, and this is the one I get the most questions on, and hopefully will be very helpful to those of you listening today. And that is how we used our Justice Information Management System to do what's called the brief jail mental health screen on every inmate that gets booked into Johnson County Jail. So as we were setting this up, this is a validated instrument, and these are the actual questions as you see them right here. This is the actual screen within GIMS. where it's 8 simple questions that can be administered by anyone. So the big question was, well, if we ask people these questions and they answer, that's going to be protected health data. We're not going to be able to share that. How are we going to work with that? Well, the way we were able to work with that is these 8 questions are asked by our deputies. And Johnson County Sheriff's Office is not a covered entity under the guise of the federal government. They do not bill electronically to Medicare or Medicaid for the services they provide. They do have a third-party medical group that provides medical care, but they're not the ones administering the brief jail mental health screen. The deputies are. So any information shared through that brief jail mental health screen can be shared. So in this case, this brief jail mental health screen gets filled out, and if you answer yes to 3 or more of the questions, you get flagged in our Justice Information Management System, because one thing I will tell you about Johnson County, we are an affluent county. We are one of the richest counties in the country. So most of our inmates do not stay in the jail much past 32 hours. You get booked in, most of the time, most people in Johnson County have the ability to bond out. Well, if you have screened through the brief jail mental health screen and you've screened, as possibly having an undiagnosed behavioral health issue, and you've already bonded out and you're not back out on the streets, what do we do with you? So what we do is we take this brief jail mental health screen and we flag it, and then this information gets sent to Johnson County Mental Health, where our clinicians over at Johnson County Mental Health reach out to these people once they're back out in the community and say, hey, we know you were booked into the jail. We know you completed this screen. We'd like to talk to you, possibly see about referring you, possibly do an intake. And we have had tremendous success with this. In fact, the University of Notre Dame is currently doing a research project based on our brief jail mental health screen to show the positive outcomes that it's having, deferring people from ever coming back into our jail. So this is one example, just a couple examples how the Justice Information Management System has been utilized here in Johnson County, specifically on the criminal justice side, but it also has blended itself very well into our behavioral health community as well. But we weren't satisfied with that. So what we decided to do to build upon that was we wanted to build something similar on our human service side. Because in Johnson County Mental Health, developmental supports, which is people that we serve that have intellectual and developmental disabilities, our aging community, our homeless population, those are all county services. So what can we do on that side? So about 12 years ago, one of our champions, our county manager at the time, very much pushed us to develop another platform. This one being referred to, it's on its 3rd name change, we refer to as MyResource Connection. And what this does is this allows anyone that's part of our human service departments, and that also includes our criminal justice community, to come in here and more readily share data. Now, I want to stop right here and again, re-emphasize that is sharing data where it is legally appropriate to do so with or without a release. And I will give you examples of how those happen. So in this case, this is an example of a probation officer with our Johnson County Community Corrections. You'll notice this has been whited out, so we're not violating HIPAA and we're not sharing protected health data. But what this is this would be an example of her caseload, her clients or consumers that are on probation, and the little red flags out beside the client ID numbers is how she knows, hey, this individual has also interacted with another department or agency who we're sharing data with. It thereby allows those case managers to click on that flag, open this up. It's going to provide information like where do they currently live as an address, okay? Who's their attorney? Who's their contact for probation? What's their client, residential address? What's their client residential phone number? If they're on supervision, they're on for, like in this case, they're on with a felony, it's going to also give you their booking information. But we can take it a step further where our service timeline gives us the ability to provide one golden record for this individual. And I'll show you that here in a minute. It also allows for seamless communication that is secured within the application. So as you can see here, you hit send message, it's going to populate a message from myself to Ms. Bond. It's never going to identify the client or the consumer. It's only going to identify them by their initials and their system ID number, at which point I can enter a message saying, hey, I see we share this client. Maybe we need to get releases signed. we need to be able to communicate about this individual so that we can provide a more holistic approach to case management with this individual. And then, as I mentioned before, that one golden record, when you click on service timeline, this provides a chronological record of every interaction this individual has ever had with Johnson County government and the services that we share data with. Again, not everyone with access to MyRC is going to have the same level of access. So I want to make that very clear. Okay? I have this level of access. What you're seeing here is my level of access because I am the HIPAA privacy officer for the county. So I can see that this person's been involved with our community corrections. I can see this person has been to our multi-service centers where they were receiving medical optical payment assistance. I can see when they were booked into jail, but you know what? I can also see that they've had ambulance calls from our Johnson County Med Act where it identifies where they were transported to and what the first impression was for those incidents. So I mentioned earlier, one of the objectives is to be able to identify who can and cannot already share data. So one of the things we had to overcome here in Johnson County was getting our department directors and our managers to understand that Johnson County Med Act, which is our ambulance service, they do bill electronically to Medicare and Medicaid for the services they provide. So does Johnson County Mental Health. They are both considered covered entities. If they are serving the same client or consumer, they can, under law, under HIPAA, they can freely share information without a release from the client or consumer. So within our application, that information flows seamlessly because it's already allowable under the law. To put an additional business associate agreement in place or have clients or consumers sign additional releases of information is not really necessary. It's not to say it's not a good idea and that you can't do it, it's just not really needed, okay? So what we're trying to do is find what are those seamless and more efficient ways to share data. That took us to the final thing I'm going to talk about today, which is it's great to be reactive. And that's what GIMS and MyRC both are. They're reactive. They're data sharing platforms that once somebody is already involved with Johnson County government in some way, shape, or form, they're involved with the courts, they're involved with our Johnson County Mental Health, they're involved with one of our other service providers, they're already involved. But what could happen if we could get ahead of that? What if we could reach people before they got involved with Johnson County? And that's where we had the opportunity to get involved with the University of Chicago's Data Science for Social Good. And we did this back in 2016, and we are still interacting with them today, where our goal, what our hypothesis was to be able to identify those individuals who are most likely to have a police encounter resulting in a jail booking within the next 12 months. And the way we went about that is by taking our Justice Information Management System, our Med Act data, as well as our behavioral health data, providing that to the University of Chicago and be able to identify where is the sweet spot, which would be where all three of these intercepts connect, and identify who those people are. So what we did is by using that data, we were able to identify that there were exactly 104 individuals who were booked that met that criteria. They had interacted with all of those systems. Those 104 individuals accounted for 19 years of total jail time. What we also found out is that those people that were identified had just been out of service with Johnson County Mental Health. They had just been out of receiving any kind of behavioral health services a little over 2 years. And then last but not least, these are the individuals, and I know I'm preaching to the choir to everyone listening, these are the people that stay in jail twice as long. So what we did is we took that information from all of these partners you see here, and we have built upon that platform. We have built upon that machine learning model to where now we are doing outreach to individuals identified through this machine learning model, and we are actually referring people before they have that adverse interaction, ending up getting booked back into our jail. And this is another one that the University of Chicago is doing a research project on to show the success that we have had, because the biggest concern was you're going to go cold call somebody about them potentially being at risk of being arrested when you don't have anything more than machine learning data But what we have found is more than 98% of those that have been outreached have been very receptive, open, and actually acknowledged that they've wanted somebody to talk to. And we've been making those referrals to those outside agencies and making sure these people get deferred, don't end up back in jail, and end up being more successful in their lives and also not costing the county money. So with that, at this point, that's my presentation. I'm now going to turn it over to Steve and Kim and let them take it from here.
I would have said no to doing this presentation, but maybe it's helpful for those of us who are not quite that advanced, but want to be. We really look to Johnson County as a model for a lot of the work that we do. So big thanks to Chris. I would just also add, they've been really, really open and helpful and are a great resource. So I'm Steve Hollis. I'm the Human Services Manager here in Boone County, Missouri. I'm in a unique department. We're a local public health entity, but we also have a human services arm, which is what I administer. Needless to say, we're a little overwhelmed these days with the pandemic, but happy to carve out some time for what's been a long time project of ours. I will also now introduce Kim Keaton, who is a key partner in the project we're going to describe today, and Kim's going to present in just a little bit. Kim's with Corporation for Supportive Housing, and they're based in New York, but Kim is actually in Kansas City. So Chris and Kim and I are all actually in the same region. So with that said, just a quick overview of our community. We're in a county called Boone County, and we're in the middle of Missouri, and our largest community is the city of Columbia. We're a college town where the University of Missouri is located. And just as Chris did, it's funny, we both do the same thing here in flyover country. We are that Missouri in red. It's red for a reason. And I circled, although it's a little off, Boone County in blue, and that's blue for a reason. We're kind of a blue island in a very deeply red state. Our primary industries are education. We have a University of Missouri here, but also 2 other colleges. We're a healthcare hub for the region, and we have several insurance businesses. We are not nearly as affluent as Johnson County, Kansas, but a relatively affluent community, what you would imagine probably in a Midwest college town. So our child poverty rate tends to be a bit lower than the state and national rates. We really struggle with racial disparities. That's probably the issue I've worked the most on in my career. Some really alarming disparities by race, and we'll talk about that a little bit later when it comes to homelessness. We also really struggle with housing cost burden. Our college student population is a huge economic driver for us, but there are some side effects, and one of those is it creates a really artificially high housing market rate, and so our housing cost burden is quite high. This affects our efforts in homelessness tremendously because landlords here can rent to, say, 3 college kids with parents with perfect credit scores versus one of our folks who are trying to get off the streets with a criminal record and no credit history. So that's a challenge. We're a small city. I do now have our updated 2020 point in time count data. As I started to say, we're a small city, but we kind of have a bigger city homelessness problem. We're averaging around, I'd say, 275 homeless individuals. That's literally homeless. It doesn't capture housing unstable folks. So we're kind of a small city with I'd say, a bigger city homelessness issue. A lot of that has to do with our location in the middle of the state on a major highway, but also as a major medical hub. We have one of the few quasi-public state mental health hospitals here. And so we have a lot of people that come here for health care, including mental health, and don't have the means to go back. We also have a lot of, we frankly have a lot of rural counties that just drop people here because they don't have resources, particularly as rural hospitals close. We more specifically have been working on justice system issues and healthcare issues to some degree as they pertain to homelessness, but also more broadly. One of the issues that I'm sure many of the people deal with if you're with county governments or is jail overcrowding, disproportionality that we see people of color highly disproportionately affected by our justice system, healthcare costs in our justice system, and recidivism. And then in Missouri, we have a grossly underfunded mental health care system and no Medicaid expansion. So those are significant challenges for us. Our vision, which we'll talk about in just a moment, it captures several kind of initiatives that we've had. But our vision has basically been to decriminalize homelessness and mental illness. So I would say essentially stop arresting and putting people in jail because they're homeless and or experiencing mental illness. And those cross over many of the sectors that Chris described for us. Our initiatives, and these will look familiar to some of the folks, particularly county government folks, Stepping Up Initiative, Data-Driven Justice, Advancing Cross-System Partnerships, then CIT. We really have had a lot of success with our specialty courts or treatment courts. We've done sequential intercept mapping twice. And then housing, we really in Missouri were very early adopters of community of housing first and coordinated entry. And then on mental health, our community several years ago made a big push to pass a children's services tax, which is allowable under Missouri state statute as a mill tax. And in doing so, we've made some real progress on children's mental health, both in direct services and also in initiatives to coordinate services, reduce stigma, increase help-seeking behavior, et cetera. One of those projects we worked on is a family access center, which is a partnership with the University of Missouri in which families can seek objective evidence-based screenings and assessments, and then they receive clinical case management into services. Our partners have been the Boone County government, so the county commission. We have had a long-standing champion on the county commission of this work. Our Boone County Community Services Department, our Sheriff's Department, actually it's been an excellent partner, and they run our jail, and they have a vested interest in this area. Our 13th Judicial Circuit Court is an incredible partner. The court administrator and the judges are really bought into these efforts, particularly around the area of reducing the burden of mental health on individuals and on the justice system. The City of Columbia, which is where I'm an employee, our Department of Public Health and Human Services, our Muni Court, we just implemented a community support docket with a special docket for veterans and persons experiencing homelessness, and our police department. And actually, we're pleased to say we're looking at starting a co-responder program with our police department. Other partners that have been key have been the University of Missouri, in particular the School of Social Work. VA Hospital has been an amazing partner in many ways, particularly in the area of homelessness. Our community behavioral health providers, and we use that term broadly, to include mental health providers, but also substance use disorder treatment providers. Many of those are nonprofits in our community. Our prosecuting attorney, the public defender, and that's both at the city and county governments, nonprofits, other than our behavioral health providers, so basic needs providers, folks that do homeless street outreach for us, agencies like that. And also, I should say, our housing authority, which administers both our public housing, but also our housing choice voucher programs. I think I've failed to list them there, but they're an incredibly key partner in our work. And then actually the faith community has really been a big asset for us in addressing unsheltered homelessness. Who we have been really challenged to engage is our healthcare systems. That actually has been a real barrier to some of our work. We know when we look at high utilizers, which is an area we focused on, we really just have not been able to engage the hospital. Some communities have gotten the hospital systems to buy in, both with partnership and funding to address high system utilizers, and we just have not had that buy-in yet, but we're hopeful that we may have that someday. The outcomes that we've been seeking at the community level or systems level are to reduce jail overcrowding, to reduce recidivism, and reduce the number of people with mental illness in jail. And I would just add to that also just reduce the number of people who are experiencing homelessness and due to their homelessness, they're in jail. So really petty crimes like trespass, things like that, missing court dates. And that applies to both of those populations. And there's a lot of overlap there. The significant portion of our chronically homeless population also experiences mental health issues. And many of those folks have dual diagnoses. At the individual level, we're seeking to increase housing stability, improve economic opportunity and stability, and improve health outcomes for these individuals. And I mentioned our frequent utilizers. Some folks call those high utilizers. We've started calling them frequent users. Don't really love that term either. I don't know the best term, but basically that Venn diagram is a basic way of showing we're trying to, because we have such limited resources, particularly here in Missouri, we're really focusing on the highest utilizers of human services, healthcare, and justice. We have not, again, had a lot of luck on, say, emergency room partnerships, but I'd like to think about healthcare more broadly, and we have had really good partnerships with some of our community-based mental health providers. So there's some healthcare involvement there. And here is where I'd like to turn this over to Kim, because let me bounce back to this slide. When we were looking at these folks, we didn't have a great way to do that. We had in the human services world the HMIS system, or Homeless Management Information System, that many of you may be familiar with if you deal with HUD continuum of care funding. So we had that, and then we had a jail that was a very willing partner in this work. Also, our jail had implemented a brief mental health screener. So we were looking for a way to find these high utilizers. So forgive me for the poor transition here, but that's where Kim comes in, because we wrote a grant to CSH and received that grant, and then we're fortunate to partner with Kim, and it was really great because Kim's actually in our area. So I'm going to turn it over to Kim to talk about their larger project, and then we'll come back and talk about how we implemented that project here.
Sure. Thanks, Steve. So CSH stands for Corporation for Supportive Housing. And like was introduced earlier, we are a national nonprofit headquartered in New York City, but with staff located throughout the country. And we provide supportive housing lending assistance, but also technical assistance and policy and advocacy and training for all issues around housing and services. And from my own history in this work, I've been working on our signature FUSE initiative for many years, and FUSE stands for Frequent User Systems Engagement, and it's a program that really focuses on integrating data across systems, finding the folks that are really cycling between those systems, and placing and finding them and placing them in supportive housing and really measuring those outcomes. And we wanted, I'll tell you why in a minute, but the end of the story is that we sought funding from the Arnold Ventures under the Data Driven Justice Initiative and matched that to funding from the Federal Social Innovation Fund to do this work. So next slide. And our theory of change, like why would we be so interested in integrating data, and what does that mean when we say pay for success? And so what we know is that data across systems that is integrated can be used to do some of the great things that, for example, Chris talked about in his presentation from Johnson County earlier in terms of coordinating care and predictive analytics. It can also be used to really capture those true system uses. So when one person is released from jail and they're picked up by the homeless system and then they're in their emergency room and so on, and then apply costs to those uses so you can really make a case for why a different type of intervention is needed, because you can show what those costs are really costing a community as a whole rather than each system. And on the back end of any sort of intervention, you can also look at outcomes. We also know that targeted supportive housing, so housing plus services for frequent users under CSH's Hughes model has been evaluated many times, and other studies have shown that supportive housing for this particular type of group reduces system uses, so people slow down their returns to jail. They definitely, once you give people a home, they definitely, very infrequently return to homelessness, and often they shift their utilization of hospitals to a more preventative type of care, and that really results in improved costs and certainly improved outcomes for those individuals in housing and an opportunity to thrive in their communities. In terms of financing for these types of intervention, like nothing's free, right? But we know that privately financed pay-for-success models can help to support innovative financing like this can help to support scaled-up supportive housing interventions, but really only if the data is there to build the value case. And so we wanted to sort of link these three ideas together into a project. So next slide. We, after securing the funding from our funders, we selected a data, like sort of a programming partner at the same group at the University of Chicago that Chris mentioned earlier, called the Center for Data Science and Public Policy. They are actually now located at Carnegie Mellon University, so they've moved since then. But this project took place between 2017 was when we selected, competitively selected the 4 communities you see here, which includes Boone County, Missouri. And we wrapped up, worked with them largely through 2017 to secure data sharing agreements. 2018 was when the platform was built and stood up in the sites. In 2019, we wrapped up the grant. Our overall goal, I think, one of the things that Steve highlighted was that for communities without many resources, they're often looking for something out there that they can use that's easy and isn't going to create like a need for a big technological infrastructure investment that a county may not have. So we wanted it to be open source. We wanted the matching tool to be simple and easy to use. We didn't want the privacy barriers to be too high, and so we wanted to start with homeless and jail data because neither of those rise to the level of HIPAA. I will say that in a couple of the communities, they were able to take the results from this particular tool and then send those matched results to their behavioral health or to their hospital system for a one-time match outside of the system. So it really created some energy around data matching and integration in the community that wasn't there before. We wanted this to be sustainable in the communities that we selected and adaptable to other communities. And indeed, since we wrapped up that grant, we've helped 2 other communities to use the tool. And we wanted it to be a platform for systems change. We really wanted the community to be able to look at the overlapping Venn diagram that you see that Steve talked about, and make those sort of policy and process changes that result in better outcomes for the people that we serve. So I think I'm going to turn it over to Steve again now to walk you through the process.
Okay, thanks so much, Kim. And again, many thanks to Kim and CSH, because that project really, the support through that project really helped us move forward with about what I'm about to describe. Kim's first bullet was make it simple. This is not a complicated system. I will admit I'm a little disadvantaged here because while I wrote the grant and kind of designed the project, my colleague Kelly Hollis actually implemented it, and Kelly's no longer with us. So it's been interesting putting this presentation together, but I think I know enough to get us through here. So I will say too, we set out, we wanted to integrate the behavioral health data from the jail, and we weren't able to do that for a variety of reasons. One of which is good news that all of our law enforcement agencies in our county were in the process of implementing a common RMS system, but they were a little overwhelmed. And but we, like Kim said, actually plan to use the system in other ways. So while we didn't get to that portion of the project, we hope to, and I want to talk about the two kind of data sets that we did work on. One of them is, basically really easy because it's publicly available data. It's criminal justice data. In Missouri, strangely enough, it's kind of an interesting situation where the criminal justice data is very public through our CaseNet. You can see almost anything about anyone in Missouri when it comes to justice. However, the homelessness data is private. That's through HMIS. So this is kind of a two-step process. One was, I guess, really it was a bit of a research project to develop the tool and to test it. And we'll talk about that quickly. What we did in the first phase, which I would call the research aspect, was we worked through University of Chicago's IRB to basically have a process by which we're able to access the HMIS data that we needed. And it was just basic. There was no health information shared. It was just literally who was homeless by name, and then match that with the public jail data. And then those two data sets, from a snapshot, a point in time, were used to then build the schema and basically then the interface for the data dashboard. So that was actually really challenging on the front end. If people have questions about that, I'd be happy to consult, because what helped us there a lot was working with the university that had an IRB process. So I do want to share that with the group. And then once the tool was developed and implemented, we did use, and still do use, a special release in our coordinated entry packets. And I'm sorry if there are folks in the call that don't know what coordinated entry is, but that's a HUD thing through the Continuum of Care funding. And basically, we create what we call a by name or a prioritization list of all of our folks experiencing homelessness, using their name. And then that all goes in the HMIS system, and there's a lot that goes with that, like VI SPDAT scoring and things like that. But that is private data, and so we do have a release that says that the folks will allow their just really basic information. It's essentially just name, birth date, and their housing status to the county. We'll talk about that more, but we do have a ROI affiliated with the process. The goals, I'll back up a little bit, were to complete and implement this cross-sector data matching tool to integrate the high healthcare utilizer data, which we weren't able to do, and then to build out a pay-for-success housing project for the target population. And what we wanted to know were how often our folks that are experiencing homelessness were in jail, how long, and who were they. These are some of the challenges. Sorry, I got a little ahead of myself earlier. But one of the challenges of the county was not an HMIS user. So we worked around that in those two phases that I described. One was a research project, and then later the county joined the continuum of care and became an HMIS user. It still doesn't mean they can see everything, and we still have that special consent that people sign. Our legal advisors felt that was the safe route. There was some discussion about if that was even needed, because if you're an HMIS user, you can actually see everyone in HMIS, at least in your region, and their status. But we took the safe route as a governmental entity. One of the early challenges was that the HMIS lead was not willing to cover the cost. So what we did was, I'm on the board of our continuum of care, and basically what we were able to demonstrate was if we could pull this off, there was a lot of value for the continuum, and then it could be replicated and have potential cost savings down the road by reducing our rate of homelessness. One of the challenges we had in building the tool was the data field definitions differed, but what really helped us there, and I should say between HMIS and our jail system data, was that our county IT department was really involved in the process, and that was actually pretty easily resolved because they were involved. The data matching tool is web-based, so it's super easy. We don't really have to host anything, anything major, I should say. This is there, I have no idea about, but if you guys want to talk to anybody, our IT department at the county is very willing to talk. I guess it uses Python code. I have no idea what that means. But the results are displayed in a web interface, the county uses another tool to better parse that data, but it was all actually very simple. Kelly, my colleague, doesn't have an IT background. She's an attorney actually by training. She was able to figure this out and use it quite easily. These are the key data fields that I described earlier. I'm sorry, I forgot about Social Security number, and that actually was the biggie that the county legal folks, why they wanted that release. And it's simple. It's just we spit out an Excel spreadsheet out of HMIS, and the county staff are able to get an Excel spreadsheet of the jail data. It goes in the tool that University of Chicago helped us build with the support of CSH, and then it kicks it out in an interface. It's been really useful. We figured out who our frequent utilizers were amongst our homeless population of the jail. We saw that what we suspected, but now we have the data to prove it, which is that they have longer jail stays, and that just like in the justice system overall and the homelessness system overall, African Americans are overrepresented in both of those systems, and the cross utilization as well. So we have been using that in our coordinated entry process. We sit down every 2 weeks as providers, with releases in a confidential manner, and then we go through our by name list or our prioritization list, and then we actually house people based on the highest risk first. So we really have bought into housing first. We figure there's plenty of evidence out there that having people on the streets, particularly the high utilizers, is far more costly than having them in housing. So we take the highest risk people on the list first every 2 weeks and try to get them in housing. The primary mechanism we have to do that is through housing choice vouchers. So as a result of this project, I don't think this is really true pay for success because we didn't have a third-party investor. But what the county did was took some of our social services funding and worked with a key nonprofit partner here in the community that does a lot of our housing assistance. And we entered a contract with them to do intensive case management with the folks that we were identifying using the tool. And then our incredible housing authority, the Columbia Housing Authority, pursued and received additional HUD 811 vouchers. We got 25 vouchers. So we have been using those vouchers to house the people we identified using the tool. So our really high utilizers of the homelessness system, human services, and the jail. And then we've been using those vouchers to house them and then using local funds to pay for the supportive services. It is, I guess, pay for success, or really it's more pay for outcomes, because the county for the first time said that this provider will get a base rate, but then a bonus based on terms of sustained housing for the recipients of the services. So it was really helpful, the data from the tool, to help us tell that story. Our next steps are to get back to trying to integrate the brief mental health screen. That actually shouldn't be too hard, as Chris said, since the jail's owned by the county and the county staff and another department would be implementing this work. We're also starting to work with our 911 staff on some diversion things. Our dream would be to integrate the emergency departments from our hospital systems. That probably is not real likely. The pandemic has not made that any easier, so that may be a longer term goal. And I think that's our presentation.
Thank you all. Please note, and we notice that some of you have been submitting questions, but please do submit your questions to the presenters in the Q&A pod. The presenters will address as many questions as time permits during the discussion group to follow. Also, there is a certificate of attendance that is downloadable. It is not a CEU or certified by an accredited organization, but it can be added to your portfolio. There are 4 webinar supporting documents available for download. One of the documents provides an overview of CSH's multi-system data linkage efforts that were just discussed. And another describes Johnson County's MyResource Connection partnership. Another document is entitled Data and Information Sharing Among Criminal Justice and Behavioral Health Partners and was designed as a supporting document for this series. Finally, we also wanted to make registrants aware of a new resource from the Actionable Intelligence for Social Policy initiative at the University of Pennsylvania, which is entitled A Toolkit for Centering Racial Equity Throughout Data Integration. The toolkit proposes ways that users or reusers of administrative data can center their data use and data practices around racial equity. We hope you find these resources fruitful in helping you think about the best ways to move forward in your efforts to build effective, efficient, and equitable data resources to improve the lives of those who interact with the criminal justice and behavioral health systems. To learn more about other offerings from the GAIN Center, we encourage you to subscribe to the GAIN's listserv. Also note the contact information for SAMHSA and SAMHSA's GAIN Center, including the phone number for the GAIN Center where you can call for phone-based technical assistance. And finally, in closing, for the webinar portion of this event, thank you for your time and participation. We encourage you to join Kim, Steve, and Chris for the discussion group that is taking place next. Again, some of you have submitted questions in advance, and those questions have been shared with the panelists. And for those of you who have submitted questions in the Q&A pod, those will be available to the panelists too. Thank you again, and please head over to the Adobe Connect platform to join the discussion.